All right. So let me do this. Why does it say 15 minutes ago? All right. Hi. How are you doing? Hold on. Um, Hi, Andy. How are you doing? Hi, Anand. How are you guys doing? Where are you joining from? Welcome, welcome. Double tap the live as you get here. All right. So thank you for tuning in. It is Friday evening. Aren't we happy about that? Thank God it is Friday. Okay, Amanda, you're from India. Okay, what time is it in India now? Hello, hello, look after your piece of the planet. Welcome. Thank you so much for tuning in. All right, so today, thank you so much, Nova. What comes to mind when I hear the word Pakistan? Pakistan. Okay, it's 4 o'clock in the evening or morning? Morning. Okay, nice. It is 4:43 here in the US, well, in Texas. Okay. How is that going to benefit you, Andy? Hi, everyone. Welcome, welcome. Double tap the screen as you get on at the live. You can always put where you're from. Hello, Raj. Thank you so much for tuning in. How are you guys doing? How is the day going? And Happy New Year, seeing that we're meeting for the first time. Yeah, so today we're going to talk a little bit about accessing healthcare in Jamaica, just in case anyone is planning on going there anytime soon, or just for general information. So thank you so much to you, Ananda. Thank you so much for that as well. Yeah, so we're going to talk a little bit about accessing healthcare in Jamaica. Have you been to Jamaica before, Anand? I'm going to give it a few more minutes to see if anybody else is going to come on. Why I can't see it coming up? Is that good, Andy? You're asking me to show my fingers. Is that good? Hi, Santanu. Hey, Vanessa. Thank you so much for tuning in from France. What's the weather like in France for you now? Have you guys been to Jamaica or have that on your bucket list? Oh, it's cold and raining currently. Oh, my name is Stacy. My name is Stacy. Stacy, and to be exact. All right. All right. Anything else you want to ask, Andy, apart from me standing up? Okay. Probably that's the Andy that is on the live here. Look after your peas. All right. Okay. You're like Jay-Z. Well, I don't know. But thank you guys for tuning in. All right. So we're gonna talk a little bit about accessing healthcare in Jamaica. I know probably some of you won't be, visiting, but just in case you are, we're just gonna briefly touch on that for a few minutes. So yeah. So I'm a nurse, just in case you're wondering. All right. So I talk a little bit about everything, but mostly nursing content. All right. Oh, yes, it would be nice for you to visit there when you get a chance. You'll enjoy the food, the people, the beach. Yeah, you'll enjoy everything about it. I don't think you'd want to go back to France after you're finished. Is it? No, it's not France. But wherever you're from, look after your piece of the planet. I don't think you'd want to go back to your location when you're finished. It's humid. Okay, yes. Yes, it is a little bit humid sometimes. Um, But when was the last time you went there, Santanu? Oh, no. Well, I'll probably visit India one day, Anand. Yeah, I'll probably visit India one day, but yeah, unfortunately, it's not in my top 10, places to visit as yet. I have some other places that I would definitely want to visit, and then definitely, I'll come over to India one day. All right. So, as I said, we're just going to talk about a little bit about accessing healthcare in Jamaica. Um, SK says it's freezing here in South Florida. Oh, I'm sorry. I think the temperature outside is like 32 right now. I think the sun came out a little bit, so hopefully that will be melting the ice. But I don't think, tomorrow is gonna be any better with, driving. I think it's gonna be black ice tomorrow after the sun melts up some of that snow. Hey Marvin, welcome, welcome, welcome. How have your day been? My day has been good. Thank you. Okay, so it's 65 degrees in South Florida, but that's not bad, SK. 65 can actually live with. I can live with 65. Yeah, that's not bad. I can deal with 65, but anything below that, oh Lord, that's just too much. Of course, SK. Jamaica is a really good place to retire. And so, the only thing is, when it comes on to healthcare, that's the only problem, But if you have good insurance, that you can access certain things, then you should be fine. But a lot of persons, returning, That's one thing that they're concerned about, healthcare in Jamaica. So I just want to kind of touch on it. So you can hang around just in case you want to, retire in Jamaica. You can hang around for the life here and just kind of hear a little bit about our health system down that side. All right, but just like any other place, you have, there's always a shortage. They always have their flaws, and it's no different for Jamaica. So we'll just talk about that. Muasha says, I think we have the same hair texture. What you use to make it soft. It's a struggle for me. I tell you, Muasha, well, I just use so I use the Cantu ear products to wash, and I use regular hair oil. I don't really use anything much. I think I use this American Pride moisturizer, and what's the other one? Uh, I use a spray as well, but it's not really a moisturizer. Um, what's that name again? Yeah, but I use a spray, but I don't really use anything much or anything fancy in my hair. So yeah. Uh, is there a king and queen in Jamaica? No, apart from the dancehall king and dancehall queen. No, we don't have one in Jamaica. Yeah. All right, but hi everyone. I notice there's 14 persons online here. If you don't mind just double tapping the screen, that would be nice to give the video a thumbs up. Dr. Bronner's is a great soap. A soap for, what's that soap for? For the hair, face, general body? Hey, Miracle, welcome. How are you doing? How has your day been? All right. So, as I was saying, in Jamaica, we have, the public and the private health system there. A lot of persons tend to, or majority of the population uses the public health system. All right. You have the private health facilities that a lot of persons definitely will go to, but most of those persons would have their insurance and all, so they definitely access those facilities. Oh, it's Castile soap. Okay, yeah, I know Castile soap. We used to use that as well. I know Castile soap, but I don't use it for my hair though. Yeah, I don't use a Castile soap for my hair. But I don't like the smell of Castile soap. It kind of smells old. Yeah. All right. So I work in the US here, but I used to work in Jamaica. I did 4 years in Jamaica, working as a nurse in the emergency room and other areas. Vikram, thank you so much for tuning in. All right. So when you talk about, accessing Jamaica weather is so unpredictable. Well, most of the time it's warm unless it's in the that hurricane period. But then again, you can always track the hurricane. But otherwise, the weather is pretty good. I don't think a lot of persons complain about the weather that much, Santano. Yeah. It's not like the US here where we know definitely if the weatherman says 12 o'clock, it's gonna rain and then 12:15 it's gonna stop. Yeah, we don't have that kind of reading in Jamaica. If it's gonna be raining, it's gonna be raining for the entire day. So just plan for that. It's not no plan for 1 hour, 15 minutes, 30 minutes. Yeah. I'm so sorry. Look after your piece of the heart, the planet. I'm so sorry to hear that. But you can always do short trips with her. If you don't want to do long trips, you know, you can always try, short trips and just try to make the best of every situation or, whatever social activities you guys engage in. All right. Thank you so much, Craig, for saying that. Vikram, now that Trump is in office, are you worried? No, dear. I'm not worried at all. All right. I'm not worried at all. But either way, Jamaica is home. So home is where the heart is. All right. All right. So as I was saying, in Jamaica we have free healthcare access. That has been there for since like 2008. So majority of the public, access public health the public health system there, so the public hospitals, and the others definitely will go to like the private facilities. In the public hospitals, sometimes you are required to pay like a little fee, but it's not like say mandatory when it comes on to those fee. But if you do have your insurance, you still go ahead and pop it out, and they'll run it, and they'll get their payments for whatever. But it's not something that is like mandatory. All right, but it is encouraged. When you go into like the public hospitals, it's more like it's not like the US here where you get every test under the sun, being done. If you go in there, whatever it is that you're going for, then they'll definitely run specific tests, but you might not end up getting all of those tests done in the facility or the hospital that you are at. Um, certain things you definitely um, certain things you definitely have to pay for out of pocket, just because it's a public health system, and not all the resources are available. So sometimes, depending on if you need a CT scan, whether or not it is like for a stroke, if it's for a trauma, you might have to go to one of those private facilities to get those done. Yes, please do. Please do look after your piece. Thank you so much, guys, for tuning in. All right. So as I say, even though it's free access to the service, not everything you will definitely get done like in a timely manner, or you'll get done at those facility. Oh, I'm talking about the Jamaica's healthcare system, Santano. Yeah, accessing healthcare in Jamaica. All right. So, as I say, it's free for all. When it comes on to the services, as I say, you have the public system and you have the private system that you can access. All right. Where is that information? Where did you go? And then with the public hospitals, you have, I think, about 24, 22 public hospitals are that you can get access to across the country or the island. Um, Most of them, or the major ones, are like the Cornwall Regional, and you have the Kingston Public Hospital. You also have Mandeville Regional, but it's not one of the major hospitals in Jamaica. Um, where is that? Hold on 1 minute. Okay. All right. And then in terms of primary care services, you definitely can access anything through your public health centers and your clinics. So when it comes on to maternal health, child health, immunizations, all of those you can actually get access through with your primary care or the clinic. And as I say, you have the secondary and tertiary care access, where it's mostly through the region or the public hospitals you get those services. And the hospitals. So we have a total of 24 public hospitals in Jamaica, and the major ones are the University Hospital of the West Indies and the Cornwall Regional Hospital there. Hi, sis. How are you? Hi, gamer. I'm doing fine. How are you doing? All right. And across the country, we have a total of like, say, about 300 health centers that you definitely can access. And, through those, some are in like communities. So, but a lot of times, because of lack of resources, no, I'm a nurse. Because of lack of resource in terms of, like manpower, nurses, doctors, health aides, the facilities or the clinics in the rural area, sometimes, persons are not able to access those because you don't really have that much persons working there, or the supplies, to operate in those areas are just a little bit low. So some things, like say for example, if you need an injection, or if you need something for cough and cold, some persons will not go and seek out care at those facilities in the communities, just because you know you might not have a doctor in time or a nurse there all the time. So they'll end up going back to the public hospitals to get access for minor things. Is it normal to crack collarbone? No, it's not normal to crack collarbone. Gamer. All right, depth north recipe for jerk chicken, please. My meat is not seasoning all the way through when I cook it. Probably just need to kind of season up from overnight, and if you have all of your seasoning there, I would just say let it just marinate for a little bit overnight. Sometimes you'll find persons kind of stick the chicken, like, with the knife, kind of just juke it up a bit, so that way the seasoning goes on throughout. All right, so that's all I can tell you regarding. I don't know what seasoning you're using for your jerk, but just make sure you have like a pimento seed there, or sometimes you'll have jerk seasoning if you can get access to that. You need some pepper. You definitely need what else? They also have some jerk sauce that you can buy. If you go in the stores, just always look for the Caribbean section, and there's always like a Caribbean Walker's Wood, or there's some other jerk seasoning that you can actually purchase. Feels like I have a crack for 5 minutes. Oh, that's not good, gamer. Probably needs to go and check that out, but I'm not so sure why you'd be having, your collarbone cracking that often. All right, had a blast test today. All went well. Okay, nice, Magic Fine. Congrats. Oh, your blood test. Nice, nice, nice. Did you get back the results already? That was quick if you got the results already. But happy to know that, it went well. All right. So when it comes on to the private, oh, okay. When it comes on to accessing, healthcare, you also have the private sector that you can use in Jamaica. And we have like, hospitals like Andrews Memorial Hospital. So just in case you're there, you can always access that one. You have medical associates. And with the private hospitals, what happens is that, it's a little bit more in terms of the services, it's faster. You might end up getting your CT scans and all of those things done in a timely manner. So in terms of efficiency, that's going to be a plus for you. But in terms of, when you compare the public and the private facility, or the hospitals, both set of doctors, they're really good doctors, because some of them do work in the public and the private. So in terms of the work that, they provide, or the service that they provide is good. But in terms of, efficiency and all, then definitely the private sector is going to be the best. But it's just that you're going to be spending a little bit more money, when it comes on to the private sector. All right. And with the with your insurance plan, you can always use it in the private hospitals as well. Let's talk about when it comes on to the health sector, or not necessarily only the health sector, because you have nurses, doctors migrating left, right, and center. So there's always a shortage there, and it's always going to be because of, the resources. Persons want more money. There's so many things that are contributing to why persons are migrating. But nevertheless, we have training facilities in Jamaica, like, the university hospital that does training for like post basic courses. So a lot of persons still do go ahead and get their training and still be able to go back into those hospitals and provide really good care for patients as well. So, all right. So so gamer say your glasses is beautiful and very unique. Thank you so much. Thank you so much. Um, Jamaican accent is my favorite accent. Thank you so much for tuning in, Don Hector. Um, I would love if you read my comments. Okay, gamer. I'm reading all your comments. All right. So the major challenges that we have in terms of accessing healthcare in Jamaica is basically going to be the underfunding, shortages for staff, and accessing those resources. All right. So when it comes on to, the cost for services, as I said, a lot of times in the public hospitals, you might find yourself ending up like, paying for certain things, because not everything is free. You will check into the hospital, you'll get your basic labs done. some chest X-ray, not chest X-rays, some X-rays you'll be able to get done. CT scans, I don't know, unless it's like the major hospitals like KPH. I don't know if KPH does, but I know probably up by the University Hospital of the West Indies, you'll definitely get your CT scans done. Otherwise, the hospitals sometimes kind of partner with or have close relationship with some private institution that does CTs or MRIs. And so, in the event that you definitely need to get a scan done, then, we'll arrange for that to be done. Sometimes, depending on what's going on, it might be a case where, the patient's relative would have to pay for those testing. If it's a dire emergency, then definitely the hospital will go ahead and facilitate getting those done. So um even though it is public, and as I say, not everybody is going to be getting like CT scans if you do go there for stroke like symptoms, or if you're in a trauma, unless it's a dire emergency, then definitely the hospital will go ahead and foot the bill for that one. And then other services, then, family members will have to go ahead and pay to get those done, and then they'll arrange. Yes, gamer, nursing it is. Hi, LK. Thank you so much for tuning in. How are you doing? Remember to go ahead and double tap the screen, okay? All right. So as I say, a lot of the cost is, on the patient sometimes. So even though we say it's free healthcare, not really. Oh, totally forgot this was in my ear. It's not 100%, free healthcare, because you might not be able to get everything you're trying to seek in the hospital or from the hospital. All right. Sometimes, as I say, you might end up paying for like extra medication, or you'd have to go and buy medications and bring it back. Um, if you're going to be doing certain procedures, then definitely you'd have to go ahead and purchase like certain items and bring it back to the facility to get those done. So, you find out that it's very costly for the patients. In the private hospitals, it's a little bit different because most of the time they have a lot of resources on hand in terms of medication, the equipment and everything. So it will be a little bit easier for patients when they show up to those facilities. In terms of specialist consultation, yes, we do have that, but sometimes, it's limited, because when you talk about like oncology services, hematology, you might find that those services, we have outpatient clinics that patients can get, those services through, but at the end of the day, the wait time usually is a little bit longer than usual. So it can be a few weeks, months before you actually get an appointment time. So that's one thing you have to think about. And so you might find that sometimes patients will get the service from private facilities or offices. In terms of infrastructure, as I say, when it comes on to the facilities based on the location, a lot of times you might find that the drive time is gonna be something that a lot of persons have to um consider, like when it comes on to whether or not you want to go into the town, because sometimes the drive time can be um 30-40 minutes before you can actually get to a facility, and not necessarily a facility that probably meets your need. We'll be able to get you settled, but then we might have to transfer you to another facility that is able to deal with your situation. So the drive time is usually long. As I say, you have your community clinics, your comprehensive clinic, but they might not be able to deal with everything that is going on, or your emergency at the time. So that is one thing you have to think about. And then the other thing is, the hospitals are usually, or the facilities, not only hospitals, but, the clinics, comprehensive clinics, they're always understaffed. They're always understaffed. And because of that, as I say, with folks in the rural area not being able to access healthcare in a timely manner, what happens is that the public hospitals, the emergency rooms tend to be packed with patients with emergencies and non-emergencies. So what is going to happen is that the wait time is going to be a little bit longer than usual. All right. And so with wait time being longer, persons get upset, staff going to get, a little bit burnt out, and all of that just cause a little bit more chaos in the facility. All right. And it's not only understaffed for nurses, it's also for doctors, what we call LPNs, ward assistants, CNAs, all of those. It's short for everybody. All right. In terms of equipment, a lot of equipment shortage we have back there. As I say, in terms of CT scan machine, we don't have one. I know the facility that I used to work at, and it was like a major, I would say it's a major hospital, we never had a CT scan machine. We never had like an MRI. We had on ultrasound. I don't know if we had ultrasound 24/7, but no, we didn't have ultrasound 24/7, but we have access to getting some ultrasounds done. We also have a EKG machine at the time, and this was up to 2016. 2016, yeah. Up until 2016 when I was there, we had probably like, say, I'm going to say about 3 EKG machines we had in the hospital. So I know one was in the emergency room. We had another one on the medical floor, and I would assume that there would have been one in ICU. So those are like some of the challenges we have with equipment in terms of like cardiac monitoring and all. We never really had much at the time. So we had to do a lot of like, manual checks on patients. So when you talk about your blood pressure, your pulse, all of those things, we definitely have to do a lot of those. In terms of, all of those machines for the pumps for IV fluid, that was another challenge. We never really had much. So we had to do a lot of manual drip rate. So, usually when you go into the hospitals, you'll see them put those machines on, and you put the IV tube in there, and then you punch in a bunch of different things to get the rate and everything. Yes, no, we had to do it the old school. You have to do, so a lot of persons, they have to be very good with maths. All right. You have to be very good with maths in terms of calculating your drip rate and literally looking on your second hand to calculate how fast that drip is supposed to be going. Unless it was like like potassium and all of those other lethal drugs, just let's just say, or some cardiac drugs, then we might find one or two cardiac machine, or the pump rather, that we definitely would have to put those on in the emergency room. But for majority of the time, it's always, we use Buretrol, or we use those pediatric tubings, and we do manual rate check for those patients. I am from Jamaica, LK. I am from Jamaica, but I'm in the US now. But I'm just kind of explaining a few things regarding healthcare in Jamaica. All right. Where are you from? All right. So that was another thing. And we talk about the medications. And in as much as, when it comes on to specialized care, in as much as we had like a lot of nurses, being trained, eventually opportunity do come. So what happens is that all of these trained nurses, end up, migrating overseas. So, but either way, we still have a lot of persons that are being trained right now. So I think the system is a little bit better because nurses are being paid a little, a little bit more. Everybody's a little more comfortable in Jamaica with their nursing salary. Not 100%, but in terms of where the rates were before, a lot of persons are a little bit more comfortable with that. And also you'll find out that the government is providing training. So they're sending nurses to get, their post-basic courses. So rather than sending probably like, say, 2 nurses for the emergency program, per year, or every 6 months. No, they're able to send probably like 1 dozen. So things are going on real nicely in terms of, getting those persons trained. And I think that is one thing that is going to help with, you know, when it comes on to nursing migration, I think it's going to kind of cut down a little bit, because a lot of persons will still want to serve their country. And if they're being paid, then that's a plus. And I think, like, talking with a few persons down in Jamaica that are nurses, a lot of them are, reconsidering whether or not they want to migrate. Because, as I say, they're able to pay their student loan, they're able to pay their rent, they're able to live a normal life, drive car and everything else. So that's something that is going on right now down there. So things are improving. All right. So I'm hoping that, a lot of persons will tend to say that, oh, the nurses, they are, I guess, when you're burnt out over time, you probably get miserable, or, persons just look at you and think that, oh, because you're not smiling, they're thinking you don't love the job, or you don't love what you're doing, or, you're just upset about something. I'm thinking, no, probably, a lot of persons will be walking around with their smile on their face now, because things are a little bit better. Even though probably, you don't have enough staffing, or you don't have enough equipment to do your job. I think they're getting a little bit happier, let's just say, for those persons who thought they were not as happy as, the regular nurses. All right. And then let's look at, when it comes on to, um the urban versus the rural area, in terms of the facility and what is available in the public and the private. Or let's look at the public. You might find out that in the bigger hospitals in the city area, they might have a little bit more resources than the ones that are in the rural area. And, just because it's a city, definitely the government is going to try to make sure that they have a lot of resources there. So you'll find out that they might have more staffing, even though I think the wait time doesn't change, because sometimes the wait time is even longer in those facilities, because everybody decide to just go there, because you have all the specialists at that facility. You might not have all the equipment, but definitely you have more specialists there to attend to your needs. So you'll have more nurses as well. All right. And we talk about, in terms of the challenges with the migration. So nursing migration, doctors migrating as well. So that is one of the challenge that we're having. But as I say, after looking at how they can improve on salary, a lot of things have been happening. So I think it's kind of cutting down a little bit on the migration. Accessing to specialized care, as I say, you might have a longer wait time when it comes on to accessing specialists in the country there. If you go into some of the private hospitals, I think you'll be able to, get specialist care there. But in terms of the public hospitals, we have like outpatient facilities that usually, so for example, you need an endocrinologist. There are days when we definitely have one or two, not one or two, but we might have one endocrinologist that comes in, like, on a Wednesday of each month or something like that. But it's not every Wednesday. They'll come in and see patients. So you'll have to book like appointments, and then you'll just have a day for endocrinology, or you'll have an oncology day, you'll have a nephrology day. So you'll have different specialists coming in on different days, and patients would have been registered, for those appointments with them, and then they'll show up and get seen by them. But it's not something where, if you feel like, oh, you have an insurance, you just feel like, oh, I want to go and see an oncologist. Most of the time, no, it's not like that, because you have limited oncologists, hematologists, all of those specialists available in the country. So usually they're so booked out, and so the wait time is a little bit longer. In terms of, we're talking about. Hello, everyone. Thank you so much for tuning in. You can go ahead and double tap the screen. And do we have any Jamaicans here, or we just have a few persons from France, India, and other places? Florida. Do we have anybody from Jamaica here? I know Marvin was here, probably stepped off. Okay. And then when it comes on to, like, when it comes on to management of certain things, it's going to be a little bit different. So, like while I'm in the US here, we do Jamaican Loving on Norton. Hi, Sammy Joe. Welcome, welcome, welcome. While in the US here, it's a little bit different, in terms of how we go about with our management of our stroke patients and our trauma patients. With the lack of resources in Jamaica, that's gonna be a big difference in terms of how the approach is gonna be. The management is basically the same textbook, but you might not have like your drugs. You don't have. Okay, that's fine, Sammy Joe. Thank you so much for tuning in. You might not have like a TPA, and as I say, you don't have a CT scan machine, so sometimes the time period is just a little bit lengthy or longer in terms of you getting that CT. So it delays a little bit of a lot of things when it comes on to the management just because of that. Another thing is that, we don't have, we have ambulances there, but it's not like the US here where, say for example, a cat stuck in the tree and somebody, having anxiety over it, you call the ambulance and you see the ambulance show up with a fire truck. It's not like that. Yeah, we don't have it like that. It's only available, you know, um we have ambulances, but it's not gonna be like all of those ambulances that you see driving around, around town here in the US. We have ambulances that are labeled as ambulance, but they might not look like, a regular ambulance in some areas, like in the rural areas. And it's not a case where you are having certain symptoms and you'll be like, okay, you're gonna call the ambulance and the ambulance show up. No, it's not gonna be like that. I remember at one point, if you wanted to call like the police, you have to have credit on your phone because not all the time that emergency number does ring. So things like those, you have to get used to, and that's one of the challenge, with moving back or accessing care in Jamaica. So for the ambulance, as I say, it's more of if the ambulance is at the hospital. So most of the time the ambulance is stationed at the hospital. And if we need to get patients who, so for example, met in an accident, we need to get them to like the CT scan, and as I said, the CT scanner is usually close to the facility, so it's not necessarily on campus. So if we need to get them a CT scan done emergently, or if we need to transfer them to another facility for higher level of care, then most of the time that's what the ambulance is for. So if you do call and, so for example, they get through, then they will definitely send it out. But most of the time it's for like, emergency services. So not because you're probably having symptoms of a stroke, it doesn't mean that the one ambulance that is available is going to be sent out to your location. Yeah, unfortunately. But yeah, so that's one of the biggest challenge we have, with that. The ambulance service, it's not like readily available all the time for the citizens. All right. Most of the time, how patients do end up get to the hospital, it's either by passerby and relatives, or as I say, they just show up. When it comes on to trauma, it's the same thing. Like, unless a police was passing or when they do show up to the scene, most of the times persons will transport, our trauma patients to the hospital. And it's not good, but it's just the reality of what, we have to deal with down that side. When you get in for your traumas, it's more, our traumas are a little bit how we deal with it. As I say, it's always going to be based off, the fact that we don't really have certain things available at hand all the time. So it might just be a little bit different than what the textbook says or what the practice supposed to be. So not all the time you are being placed in, like, a supine position or on a board to keep your spine, stabilized until we get that CT scan done. No, because as I say, sometimes we don't get a chance to do the CT scans because it's one of two things. If it's not really a dire emergency, then family members would have to go ahead and, get the funds available to get those done. You'll definitely get your x-rays and all, so at least we'll still be able to see anything that is broken. But in terms of getting a full study, a pan scan to see if there's any organ damage or anything, most of the time that's a little bit delayed. When it comes on to your C collar, we'll definitely put on C collar. If we don't have actual C collar, we will do makeshift collars just to keep, your C collar. We'll definitely do that so we can actually keep your cervical spine stable. All right, and then what else we normally do? Yeah, and that's it for basically our trauma patients. It's usually not everything is done in a timely manner, and it's always because of, the shortage of staffing and the resources. Hi, Bernard. Welcome, welcome, welcome. How are you doing? All right. Another thing is that, in terms of like when you get into the emergency room, not all the time you get into the emergency room, you'll be placed in a room because we don't really have it like that. It's not a situation like you have individual rooms in our emergency area, because our emergency room, I'm going to talk about the hospital that I was working at. We will have like observation area that will be, so for example, a 14 beds in that emergency, or say 10 beds in that emergency observation area. And then in the trauma area, that is more for your acute. So if you come in and you're having active chest pain, you met in an accident, and you have any form of like degloving injury or any form of trauma going on, we definitely put you there and you'll get seen immediately. But for majority of the patients, it's usually in the waiting area, or they'll be sitting up because we don't have that much beds to house all patients that comes into the emergency room. And as I said, we don't have individual rooms. It's like a big open space that is separated by, screens or curtains, depending on the facility that you go to. A lot of times when you get there, it's going to be more of how many doctors you probably find. You can probably find anywhere between 2 and 4 doctors in the emergency department. If it's at the major hospital, you might, like in Kingston and probably KPH, you might find a little bit more there. But for the other hospitals, it's going to be a little bit limited in terms of the doctors. All right, and then the nursing staffing is going to be anywhere between, like, say, 4 and 6. So you just have to kind of do the maths in terms of how we're going to be able to see 250 patients for the shift or for the day, with only that amount of nurses. Like, you're definitely just going to be running around in circles for the entire time. And then not to mention, because persons are waiting for so long, and everybody's emergency is an emergency, regardless of what it is, you're gonna have persons getting upset. So you're gonna always have chaos. So sometimes you might find out that persons are sitting outside in the triage area or the waiting area, and they're having abdominal pain. And in as much as probably, yes, abdominal pain is an emergency, regardless of what is going on, because we don't know exactly what organ is being, is having a problem. You definitely would want to see those patients. But if you have a motor vehicle accident that comes in, and you have, 6 persons in that accident, and everybody who has, some form of trauma going on, you have some persons are unconscious. You have probably one that you're trying to resuscitate, and you only have 4 nurses or 6 nurses in that department trying to deal with all of those. Not to mention you have, you have your not your emergency, you have your treatment area that persons are supposed to be getting nebulization treatments, injections, oral medications, and that's the same nurse that is assisting with those other patients. In as much as you might have a walkie-talkie person with abdominal pain, who looks okay, and you'll be like, okay, we'll get back to you. Really and truly, if you have somebody that is resuscitating, then definitely, you have to prioritize and go ahead and see those persons. So when you're in those emergency room, it's a bit of a challenge because you have to be on your P's and your Q's. You have to be very observant. You can't just be looking at only the vital signs, or you can't just be listening to what the patient is saying. You have to look at the patient and decide whether or not that one is going to take your last bed. SB says, well, abdominal pain can be a heart as well as GI. Yes, definitely. Definitely. But as I say, sometimes when we're there, you might have 10. Hi, Scott. Thank you so much for tuning in. When you have 10 different persons, popping in with abdominal pain, and if you only have 4 emergency room bed, sometimes it's going to be based on, you're going to start with age, how the patient look, vital signs, and not all the time you're going to have to look at vital signs, because as I say, if you have 6 persons working in that emergency room and you have 100 patients trying to, get care, and everybody is having chest pain, shortness of breath, and not to mention attending to cars that are pulling up at your emergency, area, with stab wound, gunshot wound, it's difficult to sometimes see those abdominal pain. So it's always like, you're just running around in circle and just moving persons left, right, and center just to make sure that you're not missing anybody. So sometimes it's very difficult and it's chaotic. A lot of times persons don't really understand what's going on, and that's just, some things that we have to deal with as nurses, or the nurses having to deal with. All right. Yes, this is what the ED is about, prioritizing. Definitely, definitely. Sometimes persons do get upset because they feel as though, they've been waiting for a long time. And in as much as we definitely want to get persons, in and out like Whataburger, not all the time it's going to happen. It's not going to always happen like that, because even though you probably showed up before one other person, if another person comes in, that person is having active chest pain, that one, overrides, you, depending on what's going on with that person. Especially sometimes, if you already got your EKG didn't show anything, then, we might end up seeing somebody else with the same complaint who has changes on their EKG just because of what is going on. Hi, Carolina. Welcome, welcome, welcome. How are you doing? Thank you guys for tuning in. Yeah, so that's one of the challenge, because of the limited staff, and it's not like you have EMS, active EMS that is helping out. So we don't really have, like, say, paramedics that is helping out in the field, to help with certain things. So what happens is that when we have all of those patients showing up, it causes additional, work with trying to see who we're going to be able to move from out of these 5 or 10 beds that we have. And then because of the lack of, like, a CT scan machine, when you have your stroke, like your patient with stroke like symptoms, when you have your patients with, your traumas, who definitely could have benefited from your CT scan, like in the first 10 minutes, 15 minutes, or even 1 hour, if we don't have that going for them, those patients are just going to be in those 10 beds, and you still have patients coming in. And so, with all of that, it becomes overcrowded because you have all of those emergencies that are waiting for CT scans. If it's not CT scans, they're waiting for a room because they're admitted. It causes more crowding in the department. You have longer wait time. You have patients getting more frustrated about, everything else. And it just becomes overwhelming for the staff. You know, it's just very, it's very chaotic. It's very chaotic because when you have, and it's not like you have additional nurses, and it's not like you hear, oh well, we're gonna put out a call to get some additional nurses to come down, or get some additional doctors to come down to see the patients, because even so you get them, you don't have anywhere to put the patients. Sometimes we have like an area that is supposed to be for patients. So we have rooms that we call patients in to be seen. All right. Those are the walkie-talkies, and we'll have benches that we'll definitely put them on. So we'll call them in batches of like, say, you know, 15, 20. You put them there to sit down. They get to see the doctor. And after they're seen, then they'll go to the treatment area for their IV fluids. They'll go for their oral medications, nebulization treatment, whatever it is, you know. Sometimes that area you can't even call in that much patients anymore because the trauma area is packed, your observation area is packed, your treatment area is already packed with patients that are supposed to be getting their NEBS treatment, and you have that little section now that is supposed to be holding patients to be seen. You have to resort to moving patients over there to lie on a bench to get their IV fluid because they can't sit up, or, you know, there's so many things that are going on, you know, so you definitely have to kind of get those patients back into the waiting area so you can use those benches to accommodate patients that are already being seen, or patients that needs to be on a bed that you have to turn, you know, use a bench to be a bed, or, you know, in order for persons to get care. And then what happens is that all of these persons on the bench know that you asked to go outside. They're upset because no, they're thinking that they're not going to be seen, you know, because the bench are already full. The department is packed. The only thing you can do is go outside to the patients in the triage room, put them back in the waiting area, and they're just going to be waiting until whenever a room becomes available on the inpatient setting. So it's a bit of a challenge when you get there. So just FYI, you know, be on the lookout if you are in any of those areas. And this is mostly the public hospitals I'm talking about, because in the private hospitals, as I say, you're paying your money. So there is always going to be, you know, the service is going to be a little bit better. It's going to be a little bit different because it's not going to be packed with patients, you know, because you don't have that much persons that are accessing private care, because private care is always expensive. And so majority of the population is not going to be spending that much money to get certain things done, because it's just too pricey for them. All right. So when you get there, um, it's going to be a little bit different. Sammy Joe 1964 says, I'm a pediatric nurse and was in Jamaica recently and ended up in the hospital, and your explanation is on point. I was transferred to private. Yes, definitely so. I'm sorry to hear that. I do hope your experience was good either way and everything, you know, went well. But that's the situation, you know. So when it comes on to, and then, you know, when it comes on to the hospitals, even though it is a public hospital, it's not a case where we have like private hospitals for the children and then you have the public. I think we have one private hospital for children, which is a Bustamante Hospital. If there is another one, you can always let me know in the comment box. But I know with the hospital that I was working at, we transfer our pediatrics as long as they need, you know, they need to be transferred to that specialist hospital, then definitely we go ahead and transfer them. But the public hospital does have a pediatric floor where we still admit patients, you know, but there wasn't an area for pediatric emergency versus, you know, adult emergency. But we still go ahead and prioritize, you know, because children decompensate faster than adults, you know, so we always still go ahead and prioritize when it comes on to pediatric. Sammy Joe says 1964. Sammy Joe's 1964 says it was amazing, compassionate and caring staff. Nice. Thank you so much for saying that, Sammy Joe. Where are you from, Sammy Joe? All right. So that's one thing you definitely have to, you know, be on the lookout for. But nevertheless, you know, I think the nurses, the doctors, the team, they're working really good. They're working real hard, you know. A lot of times I think we do so much that persons don't even understand, what is going on behind the scene. They don't really understand what is going on behind the scene, because when you're talking about, if you don't have your, so for example, you don't have your pumps to do your IV fluids, and you have to go around and be putting up IV fluids for like every patient, whether or not it has, medications in it. Okay, nice, nice. Whether or not it has medications in it, you have to do your manual, drip rate for those. A lot of times, you're trying to sometimes it's a case where it's, you have the bubbles or the little air in the line, and you have to try and get those out. Sometimes it can be a little bit frustrating as well. It's not all the time you have all of the things that definitely, like, with your IV kits and all, we don't really have all of that. You have different pieces that you put together to make a set or a kit to get an IV going. So it's not that much of an easy road when it comes down to nursing in Jamaica. And so a lot of times persons don't really understand. And when they get there, it's, because you're used to something, you're used to the fast service. We tend to, I'm not going to really say judge, but I guess we are expecting some things to be happening, but it's not going to be happening in Jamaica, because a lot of things, as I say, is not there. It's not available. And so it's going to be a little bit different than what you're expecting. All right, to see you all. Welcome. How are you doing? The hair is the star of the show. Oh Lord, yes, I did pull it down, so I'm gonna pull it down over the weekend and get it washed. Yeah. Yeah, so that's how the system is, with the service down that side. And then when it comes on to like certain things, I know at one point I saw this video where somebody was complaining about the sling. They got a plaster, and I guess it wasn't done to their liking, because they had like a piece of string around their neck. And yeah, sometimes you'll find that that is something that we do as well. You get your plaster for your broken arm, and we'll definitely put a string around your neck, and you hold it up until you get a chance to go and see your orthopedist. It's always okay to go ahead and buy all of the fancy, slings at the pharmacies, but it's not something that is readily available in the hospitals there. So just be mindful of that. When it comes on to your dressings, and I always talk about that, you don't really have like, say, individual, kits for your dressings. All right, you might have one big container that serves the entire floor. So if it is 30 persons on the floor that needs dressing, you have that going. All right, so be on the lookout. If you're supposed to be getting any dressing, it's not going to be any individually wrapped, kit like that. You might find that you get your individual kits for your catheters. Certain things you'll definitely get, but others it's more, multi-use. When it comes on to you being on in terms of admission, when you're admitted to the floor, you're not going to be getting any beds that goes up and down with a remote. No. You might have to put extra pillows behind if you're able to find one from home. All right, so just be on the lookout for that. So a lot of things are a little bit, let's just say, a little bit older when it comes on to, the equipment that we have. Yeah, so if you go into the private hospitals, though, definitely you will get remote beds, and you'll get everything at your fingertip. You'll get your individually wrapped dressing kits. They might have the IV kits that are a little bit more, together, rather than having individually, pieces of things that you need to get your IV started. Sheets too. Oh, definitely. Yes, you have to bring everything from home when it comes. Well, let me take that back. Most things from home when you're being admitted. So if you need pillows, you might have to just bring your own pillow, sheets, incontinent pads, diaper, everything to make you comfortable in the hospital. You definitely have to bring those, because not all the time it is readily available. Sometimes you might go and you might see one or two patients that are lying on a mattress that probably, don't have a sheet on it, because probably the sheet just run out or something. or it might be a case where we had two beds, two stretchers available in the emergency room, and an emergency do pop in, but we don't have any more sheets, so we just end up putting the patient on the mattress. But nevertheless, the beds are clean. All right. One thing about the supplies that you'll be using or you'll be getting, they're clean. All right. So you don't have to be that scared. But definitely, when sheets are available, they will be placed on the bed. But sometimes, we end up resuscitating patients under emergencies on stretchers that don't have any linens on it. All right, you might not always get a warm blanket. Do you get a warm blanket? No, I don't think you get no warm blanket. We don't have no warmer down there. I don't remember. No, we don't have no warm blanket. Unless it's just coming from the central sterile processing unit and it's warmed, or yeah. No warm blanket not down there. So don't expect to go down there and be asking for a warm blanket, because that's not available. Or the yellow socks or the red socks or the green socks, it's not available. Just bring your white socks. Yeah. All right. So things like those are just not readily available for patients. Another thing is that you might see sometimes we have the enamel urinal. Yes, or bedpan, those still exist. All right, or we do a lot of reuse, or we recycle a lot of things. All right, so we wash, or sometimes we will definitely get them steamed, and then we go ahead and reuse them. So our patients do reuse them, but otherwise you can always feel free to bring your own. And as I said, this is in the public hospitals. If you go in the private hospital, it's going to be a little bit different because you're going to be paying for everything else. Okay, so just be mindful of that. What else I can tell you about the public health? Hi Sadie, welcome. All right. What else do you want to know about the health system in Jamaica? Go ahead and type it in the comment box below. Oh, when it comes on to like transfers, when it comes on to patients, so for example, you need to be seen at another facility, or they need to transfer it to another facility, then we have the ambulance, as I said before, that we use to transfer you to those facilities. Or if you need to get testing, so for example, you need to get an MRI testing done, we definitely do that. If we need to get you to do some form of like dialysis or anything like that that we don't have at the facility, then we do go ahead and arrange for those. What else I can tell you? In terms of TPA, yeah, that clotbuster, it is not something that is readily available. It might take you a few days or so before, if you're able to afford it, that is, before you get it. But and then it would be late at that time. So but it's not something that is readily available in the facility or the hospital, the public hospitals. I'm not so sure if in the private hospital it is readily available to patients, but just FYI. And then, as I say, with the stroke patients, it's no different when it comes on with the CT scan, unless it's a dire emergency. And even though stroke and all of those things, everything is an emergency, and you definitely need to get your CT scans in a timely manner, EKG in a timely manner. Sometimes it's a little bit delayed because of, the availability for the service. And so with the stroke patients, sometimes they're not able to get it in a timely manner. And so, by the time you're supposed to get your CT scan, it's either too late, or, you have complications already from it. So that's just one of the biggest problem, or the biggest challenge, when you're moving back to Jamaica or traveling to Jamaica. You have to think about, whether or not you're going to be able to access those and all. So what else? In terms of home health services, let's just touch on that a little. When you're discharged from the hospital, we don't really have like a lot of home health services, for patients in Jamaica. You might find one and two, let's just say newer companies that are offering that kind of service, but it's private. And they might be able to help out a few persons in the city, let's just say. The urban area, I think that's where most of the pop-ups are right now. It's not something that is very big or, well established for a lot of persons to have, or when you're being discharged from the hospital, they say, okay, we'll try to get you with home health service. No. So we use our outpatient departments a lot of times, and that will kind of help or serve with that kind of need. So if you have somebody that has been discharged and they need close monitoring, then definitely they will show up to the surgical clinic, the medical clinic, after they've had their stay in the hospital until they're discharged from those clinics. So our outpatient clinics do a lot of facilitate a lot of those services for the patients. In terms of your catheter care, your dressing change, all of those is done through the outpatient clinic. All right. Yes, please like and share the live, people. Thank you so much for tuning in if you're new here. All right. Does anyone have any question or want to share anything else? All right. Let me see here. Did I touch on everything? RN2 CEO says you can get insurance that if you need to get airlifted or have procedures overseas, may have to pay a couple $100 or more per month. Yes, definitely. So, yeah, I didn't even touch on that hospital. So you can, if you're thinking about going back, I would always encourage persons to get like travel insurance to cover for certain things. There is a hospital in, I don't know if it's in Montego Bay or St. Anne. I think it's Montego Bay. Hospital. It's a private hospital, and they have like all the services that you need. They have like MRI, CT scan. They have like a air fixed wing. They have ambulance services. So if you're in that area, then definitely you can always access the care there. And I guess if you need to get transfer, it's Montego Bay. Thank you so much, Moby. So it's in Montego Bay. So if you need to get airlifted to wherever, then I think that is, one option, one hospital that does it. So it's a private hospital. So I don't know if, well, I guess if your insurance, covers for international travel, then um, definitely you can use that facility. And it's also available for those who live in Jamaica as well. But it's just that you're probably going to end up spending a lot of money. All right. But it is something that you can look into as well. But I would definitely encourage persons to look at, travel insurance plans if you're thinking about going, for long term, because that will kind of help with your care. All right. A little bit more. Sammy Joe, OMG, I just realized you're from my parish. Where are you from? So, Sammy Joe, do I know you? Hi, Kerry Gordon. One love from one nurse to another in foreign. Thank you so much, Kerry, for joining in. Thank you so much. If you haven't, double tap up the live, go ahead and remember to double tap. And if you're in a rush to go, please remember to subscribe to the channel, okay? Yes, so that hospital, you definitely can get a lot of services done there. Let me see, Hospital in Jamaica. So they have them all over, but they have a branch in Jamaica in Montego Bay. So it's Hospital Montego Bay. All right. And it's a really, really nice building. I've never been there. Yeah, never been there. But I think they have a lot of things accessible there. So if you're a tourist and you're in that area, I would just say make sure you you are familiar with that facility. So just in case, because I've heard stories about persons trying to find hospitals and they drive for hours in order to get the care, and then only to find out they weren't pleased with, the service from the public hospital. So if you're on the live or you're watching this at any time, just kind of, go and look up that hospital. So just in case you're in the area, you can have it at your fingertip, the number and everything, so they can assist you as best as possible. Sammy Joe says, no, but I am from beautiful and cool Manchester, Mandeville. Okay, well, I'm from Asia. I'm from the countryside. Yeah, man. Prattville, Asia, like you passing up Patrick, going down that side. Okay, Kerry Gordon says, I'm RN from Maypen, Clarendon. Do you want to call in, Kerry? Tell me you want to call in and talk to me. Let's hear how your day has been going if you're not at work. Yes, I used to work at Mandeville Regional, Kerry. Yeah, that's where I used to work. And Sammy Joe is on the live here from Jamaica as well, from Manchester. Yeah, man. Oh, let me pin the number. Let me pin it. Yeah, so just in case you guys want to just call and talk, I'm free. I'm open to that as well. And if you want to share your story, you can always call me one day and we sit down and talk. All right. I just want to hear your story. I share my story about, my childhood growing up and my experience with, in primary school, high school, and college. So I want to kind of hear other person's story. 469-655. 5152. All right, so I'm going to put my number in the chat here, and I'll have you. You can always go ahead and WhatsApp me. You can call me straight right now, and we'll just have a chit chat here. But yeah, so I have a little podcast that I'm trying to, work up a bit. I want to talk to a lot of nurses, and I would definitely want to talk with other persons, because we have a lot of persons that are, um, joining my channel. They're not necessarily nurses, but I would definitely want to hear what their day in the life, sounds like, or just a story that will encourage persons. That's all. And so, feel free to go ahead and call me, text me, and we can do that. All right. If you want to talk on the live here, that's something I'm open to as well. But it's nothing planned or, just wanted to be very authentic, and we just share our story. That's all. All right. Um, but yeah, so where do you work? Are you in the nursing field, Sammy Joe? Yeah. So as I was saying, regarding so we talk about the trauma, and we also talk about the we talk about trauma, and we also talk about stroke care. Okay. All right. Another thing that we don't really have a lot of is when it comes on to the physiotherapy as well. That's not something that you have access to, you know, um, around the clock. Sammy gone, plan con. Ah, yeah, is that something like that we have access to around the clock for, for patients requiring like physiotherapy and all? Oh, you work at Boston Children's Hospital Orthopedics. Okay, nice, nice. Are you enjoying? Because Boston is a very busy hospital. That hospital there, what's it called again? Um, I think that's the one I say if I needed to do. Is that the hospital that a lot of basketball players come for, like rotator cuff injuries and all? There's one hospital in Boston that is it Mass General, that a lot of athletes fly into to get their orthopedic surgeries done. I said if I do develop any, that's where I'll be going if I can afford it. But yeah. But in terms of physiotherapy, most of the hospitals, they definitely have like physiotherapy available for patients who definitely need it, so as I say, it's not something that is readily available where you can do it privately. I think you can access it privately, but I don't think we have a lot, out there. So most of them is done through like different hospitals, the outpatient departments. Okay, Sammy Joe says one of them, but yes, Mass General for them. Okay, good. That's where I say if I have any form of orthopedic, problems, issues going on, I would definitely go there because whatever they're doing to those, athletes, yeah, I want them to do the same thing to me because they seem to be doing well after their surgeries. All right. When it comes on to mental health in Jamaica, a lot of times we don't really address that as well. So we have psych facilities. So I know we have a psych facility at the University Hospital um in Kingston. We also have one at, what was that one called again? It's in downtown Kingston. So we have a facility in downtown Kingston. I don't remember the name of it. But yeah, a lot of times when patients do present, sometimes we don't really know how to, or the public don't really know how to deal with them. So when they do show up, a lot of times they show up in with the police, and so when they come to the hospital, it's another challenge to get those patients, stabilized. A lot of times we do the cocktail, the medications to kind of get them, a little bit more. Bellevue, yes, Kerry, right down at Bellevue Hospital. So that's a psych facility. And I did enjoy Bellevue when I was a student, I think they have a really good program down there. Yeah. I think they need to feature them a little bit more because a lot of persons don't really know about the service down that they offer down there. But yeah, so Bellevue Hospital is the public one that is available to us in Jamaica for our mental health. All right, and a lot of these facilities, well, I know for UWI or the university hospitals, it it does the private, and you can still do. I guess they go into the communities. I did enjoy the university hospital because we go into the communities and medicate patients. So some patients who are not able to, are not admitted, you go in monthly to get their medication. Um, administered to them. And that was always fun because you have to be running down these guys to get them medicated when we were a student. But they really have a really good program at the University Hospital. And I know Bellevue, their program was pretty good as well. With Bellevue, I know you had some persons, so it wasn't the entire hospital, it wasn't like a lockdown facility. There were some persons who definitely showed up, get their medications, and leave. So don't remember. Yeah, you have some persons who definitely get up and get their medications, go, they come back for meal, and then they leave. I remember one day after I worked at Bellevue Hospital as a student, I was in a halfway tree, and for some strange reason, there was a patient who remembered my name. And I was like, oh my word. Sometimes you're thinking persons are, but really and truly, no, they have their moments. They have their moments. A lot of times I'm walking in halfway through and patients calling my name. And I'm like, okay, then I don't remember your name, but, and it's persons you're thinking that wouldn't remember. Yeah. All right, Sammy Joe says I have to go. No problem, no problem. Keep in touch, Sammy. All right, me too. Yes, it's definitely an interesting place up by Bellevue Hospital there. It is. All right, but definitely we have in the public system, in most of the hospitals or the major hospitals, we still do have our psychiatrists that we still have on call that definitely sees patient in the emergency room, and we get them transferred to different facilities, and who can get followed up at the clinics, then definitely they will go there. But we still need to place a little bit more awareness on mental health in Jamaica. I don't think it is like highlighted, that much, even though persons, do know, but a lot of times we only think that it's the madman on the road, is having a crisis, when really and truly you have other persons who are having different things going on, anxiety, they're depressed, but because we're not really talking about it, it's not something that we literally sit down and talk about. So I don't think that is being counted as a part of, um, our statistics when it comes on to mental health. All right, because a lot of persons, they don't really have specialists to talk to, or they don't have the support system available, or I guess the timing when you're supposed to go in to see a specialist, usually the wait time can be a little bit long, so persons probably just change their mind. Hi Paulette, how are you doing? Thank you so much for tuning in. All right. Yeah. And then what else we can talk about? We have clinics. So in terms of for patients with like communicable diseases, we have like different clinics as well that they can go to. I know we have the HIV clinics that, a lot of times in the public health nurses, you'll see them doing different events for them, or they'll be attending to them in the public clinics, the comprehensive clinic. So that is one thing that is a lot of focus is placed on. And maternal health and what else? So maternal health, you have the HIV clinics and psych. I know a lot of focus is on that as well. And with the communicable disease, you always have like, um, during certain periods, they will go ahead and do spraying, when they go around and spray out the communities. So a lot of focus is on that during certain time of the year. And you have a lot of advertisements. Usually they'll talk about like dengue fever and all those things, identifying the different mosquitoes and all, and trying to make sure, encourage persons to get their homes or their backyards, prepared, so that way you're not having having like breeding grounds for those um mosquitoes. So that is something that they emphasize as well. All right. Does anyone have any questions or any concerns? And welcome everyone to the live. Thank you so much for tuning in. It is 6 o'clock. All right. Really do appreciate you guys taking the time out to stop by. Am I missing anything? No? Okay. All right. Oh, so I'm an adult gerontology nurse practitioner. So I work with adults. Yeah. So I currently do house calls. So I have a lot of flexibility on my hands sometimes, because I'll go in and see patients, and then depending, by 1 o'clock, 2 o'clock, my day is done. So I start my day at start seeing my first patient probably like at 10 thereabout, and then I leave to come home around 2 o'clock after seeing my patients. So yeah. Paulette Lewis says you are very knowledgeable about Jamaica's medical care. I used to work in Jamaica as a nurse, so I have a little bit of an idea. But not everything here, this is not all the information there, as you're aware. There are additional information, but from my experience, working as a nurse in Jamaica, I'm just sharing my side on information regarding some of the challenges that we have there. All right. Well, thank you for sharing, Paulette. Okay. But yeah, so are you thinking about doing your master's, Kerry? Oh, Kerry, one thing I wanted to ask you. What's the salary looking like now for nurses in Jamaica per month? I know in 2011, is 11 or 12? Oh, nice, nice. Congratulations. Okay, nice. Okay. So I know in 2011, I think the rate was like at 68,000 per month. which wasn't a lot. A lot of persons were crying, never really made no sense. So let me tell you how much is that in US. So 68, I think at the time, let's say, I'm gonna say about 90 something dollars. Let's say one US was $90. Jamaican. So 68,000 divided by 90. So that was roughly $755 was the base salary in Jamaica at the time. And then when I came over here and I told persons what my base salary was, what my base salary was, they started doing the math and they're like, what? I'm like, yep, that's why a lot of persons are leaving. But I know the rate has increased now because I think probably they're making probably like say about 200 per month. So let's just say 200 per month. And let's see, $1 is so roughly $1,500 US per month they're making as their base salary. So that's one of the main reasons a lot of persons leaving. Oh, you've never worked in Jamaica before, Kerry? Okay, okay, okay. So where did you do your nursing? So Paulette Lewis is asking, do you know of any group that travel there for outreach? So Paulette, honestly, my channel, I want to do a lot of outreach program, community service. So just go ahead and make sure you subscribe to my channel. Make sure you subscribe to my channel so that way, guess what? You see, when it's time to go to Jamaica, when it's time for me to take on a few persons to Jamaica, you can be a part of that crew because I want to go back. I want to start my own little charity. I do, like gift bags to persons. I'm trying to talk with a few like homeless folks, and I have a few persons that I see that, in terms of, they don't really have that much in terms of food and all of those things. So there are certain little supplies that I try to bring to them as a part of my, of giving back. But my ultimate goal is to go back to Jamaica and, help out with some of my community members. So definitely, I don't know of any group right now, but I found a church that does community service. They do like mission work, and I know they're going to Jamaica to do mission work in some of the communities down there. So definitely I would love to be a part of that group. So I will be working with them on that. But do definitely go ahead and take my number and reach out to me. And as I say, if you're interested in coming with the church group, or if you want to come with my group when it's time, because I envision myself with a lot of people on my platform. Yeah, man, we see about 4+ million subscribers. Speak it into being. Yes, so definitely I will be doing a lot of charity work, and that is something that I'm looking forward to. So, just take my number and send me a text message, and we can always talk. And when it's time to go back to Jamaica, then definitely. And another thing that I want for my channel is, because we have so many persons that are nurses, especially, who have migrated overseas. I want it to be a case where I can reach out to a few of them to say, okay, then, let's 20 of us can actually go back to Jamaica and do probably like a 1 week, 2 weeks of community service, just to say we're giving back, but I want persons who really have a passion for what, for wanting to give back, to be a part of the team. Other persons can come and enjoy, but I don't want to be a case where when they reach Jamaica, the beach sweet them and the jerk chicken sweet them. The girls down there look good. The man them down there look good, and everybody lose sight of what the mission was. You understand? So I definitely want to be a case where persons are definitely interested in, coming down there to help out with communities. If it's a case where we go to one of those like the Golden Age home, or it's like I don't really know if it's not an assisted living, but it's like one of those old people homes, we can go there and help out a little bit. But that's what I want for my crew to be doing. Help out a little bit with cleaning or cooking or doing some wellness check, whatever it is that we can offer to them. I definitely want that. All right. So while we're kind of taking in some of the sun hot down there, I want us to be working and just giving back and enjoying ourselves. Yes, skilled nursing facility. Well, skilled nursing facility. Well, I guess if you want to call it that, I don't think it's really that much of a skilled nursing facility. And it's more like a nursing home kind of vibe. I don't think they really do. Well, I guess we can call it a skilled nursing facility because honestly, I don't really know. I know the one that I visited, they weren't doing anything much there apart from eating, sleeping. Done deal. You understand? So I don't know if now they're a little bit more, established with getting like, a little bit of occupational therapy and all of those things going on. But most of the persons were independent, and so it was more, yeah, it was more like an independent facility. Cause, yeah, I don't think there was anything. I don't think there were any nurses or anybody there. Is that so? I think there was like a caretaker or something, but I don't really remember. Okay, yes, Carrie, definitely. I would love for that to happen. So that's my goal for my channel and for me as well. I always wanted to give back, so yeah, I'm looking into that. All right, but I'm starting with, here, seeing that I'm here in the US, starting with the whole program, and then eventually I'll get to register certain things and, feature certain persons on the show. And yeah, that's my dream. All right. But definitely link me on that one so we can take a trip together and enjoy, Jamaica while doing something that we love to do. All right. Thank you so much. Thank you, Paulette, for subscribing. Thank you for subscribing. Yeah. What area are you in, Paulette? Carrie, do you have a... Oh, I forgot I have a phone here. I can look up as well. Totally forgot that part. Carrie Gordon. Do you have a channel, Carrie or Paulette? Carrie Gordon. No, that's not you. Paulette Lewis. Okay. All right. Later, Marvin. Thank you so much for tuning in. All right. Enjoy your evening and your weekend. Okay. All right. I don't think that's Carrie, but yeah. I don't see a Carrie. There's so many Carrie Gordons here. Hi, Nathaniel. How are you doing? Okay. Yes, please do. Please do. All right. Um, all right. Well, guys, I will link you. Okay. Okay, thank you so much, Paulette. Thank you. At one point, I thought I was like, sharing only nursing information, and then probably other persons are not gonna be wanting to, be interested in the content. But nevertheless, there's a time and place. People decide when to hop on. So the content is there, and I just share it. And as I say, it's more of something to just motivate and encourage and inspire other persons. That's all. I know at the time when I was moving to the States, I never had like anybody to talk with regarding certain things, and I definitely wanted it to be a case where me as a Jamaican move here, certain questions I can try to answer for some persons when they're planning on migrating, even though I'm not really encouraging it. But to each his own. Opportunity comes, so we have to take it. Yeah, I take it. And but at the end of the day, we're brain drain in the country, not something that I'm proud about. But when opportunity come and persons have bills to pay and all those things, you have to just look out for yourself at the same time. So I want it to be a case where for those persons who are thinking about migrating, I am here. They can always reach out to me and have information at their fingertip. Because it's always nice to hear that, sometimes you might hear somebody say, well, the experience is good. But then, if me and you come from the same culture and I say the experience was like, kind of all right, we can't always talk about it and understand it versus somebody else who is from another culture coming and say, yeah, the experience was good. And when you go over there, the experience is totally different from what the good's supposed to be, you know. So I just think that it's nice to have somebody for reference or support who understand your culture. It's always nice to just kind of work with them at times. That's all. All right. Well, it's 6:19 here. I'm gonna end my live. Yes, definitely, Carrie. I'm gonna end my live. Any other questions before I go? And I want to say a big thank you for, for tuning in. Big thank you for tuning in to the channel. All right. I really do appreciate you taking the time out. All right. So I will see you in the next live. I will try to do a little bit more frequent live for my channel so I can get, to interact with you guys and everybody, who wants to stop by for a minute or two. And hear a little bit more about, what the channel is all about. So, all right, Bernard, enjoy your weekend as well. Good night. RN to CEO. I was planning on going to church tomorrow, but I think that, I don't think I see any sun outside. So the road is still icy and it doesn't seem like Texas, them not do anything with the road. Them a wait until the sun come out for the road to actually clear up. So I don't think church is going to be possible tomorrow, but we'll see. All right, but nevertheless, stay safe, everybody. And I will see you next week in another live or Sunday. Okay. Enjoy your weekend.